Understanding expiration dates is like having a safety net for your medicine cabinet. Expiration dates on medications are not arbitrary. They signify the point until which the manufacturer guarantees the drug's full potency and safety. This date, meticulously determined through rigorous testing, ensures that you receive the intended therapeutic benefit when you take the medication. Think of it as a safety net, a critical marker that helps safeguard your health. These dates are not just about efficacy, they speak volumes about the stability and integrity of the chemical compounds within the medication. Over time, medications can undergo chemical changes, potentially diminishing their effectiveness and even leading to the formation of harmful byproducts. The expiration date acts as a crucial checkpoint, ensuring that the medicine remains safe and effective for consumption. It's important to remember that storing medications properly plays a crucial role in maintaining their quality up to the expiration date. Exposure to extreme temperatures, humidity, and light can accelerate degradation, rendering the medication ineffective or even risky to consume. Always store your medications as directed on the label, typically in a cool, dry place and out of reach of children and pets. While it might be tempting to use medications past their expiration dates, particularly if they appear fine, it's a gamble not worth taking. The potential risks far outweigh any perceived benefits, and your health is too precious to compromise. The ticking clock is always in the background, affecting medication effectiveness. Medications are carefully formulated chemical entities designed to elicit specific therapeutic responses in our bodies. However, these compounds are not impervious to the effects of time. As time marches on, medications can undergo various chemical changes that impact their efficacy and safety. One of the most significant concerns is the potential for the active ingredient in a medication to degrade over time. This degradation can lead to a reduction in the drug's potency, rendering it less effective in treating the intended condition. Imagine taking an aspirin for a headache, only to find it provides little to no relief because the active ingredient has degraded past its prime. Furthermore, as medications age, there's an increased risk of the formation of harmful byproducts. These byproducts, often a result of the chemical breakdown of the original ingredients, can pose significant health risks. What was once a therapeutic agent could potentially transform into a source of harm, leading to unexpected side effects or even toxicity. It's also essential to consider that the effectiveness of certain medications, especially liquids and those in suspension form, can be compromised due to changes in their physical properties over time. They might separate, change color, or develop an unusual odor, all telltale signs that their integrity has been compromised. Expired medication risks are like navigating potential dangers. Taking expired medications is akin to playing Russian roulette with your health. You never know what you're going to get. While some expired medications might cause minimal harm, others have the potential to lead to serious health consequences. Understanding these risks is crucial in making informed decisions about medication use. One of the primary dangers of consuming expired medications is the lack of effectiveness. As the potency of the active ingredients diminishes over time, the medication might not adequately treat the condition for which it was prescribed. This could lead to a worsening of symptoms, progression of the illness, and in some cases even life-threatening situations, especially for conditions that require strict medication adherence. But the risks go beyond just ineffectiveness. Expired medications can also increase the risk of experiencing adverse effects and allergic reactions. As medications degrade, they can form new chemical compounds that might trigger allergies or cause side effects not typically associated with the medication in its fresh form. Moreover, certain medications, especially antibiotics, pose a unique risk when taken past their expiration dates. Using expired antibiotics can contribute to the growing problem of antibiotic resistance. When bacteria are exposed to less potent antibiotics, they have a higher chance of surviving and developing resistance, making future infections harder to treat. Responsible disposal is paramount for safeguarding our homes and environment. Knowing how to dispose of expired medications properly is just as crucial as understanding why we shouldn't take them. Improper disposal can have far-reaching consequences, impacting not only our homes but also our environment and communities. The first step is to check for specific disposal instructions on the medication label or packaging. Some medications come with detailed instructions, such as flushing them down the toilet, or mixing them with undesirable substances like coffee grounds before discarding them in the trash. These instructions are designed to minimize the risk of accidental ingestion or misuse. If no specific instructions are provided, consider utilizing drug take-back programs available in many communities. These programs offer a safe and convenient way to dispose of unwanted medications, ensuring they are properly incinerated and don't end up in landfills or water systems. Never flush medications down the toilet unless explicitly instructed to do so. Flushing medications can contaminate water sources and harm aquatic life. Similarly, avoid throwing medications in the trash without taking precautions, as they could be accidentally ingested by children or pets.